Today I will be discussing the controversial procedure transcranial direct current stimulation, or tDCS. I will be specifically looking at how this procedure is proposed to be effective in the treatment of people affected by attention deficit hyperactivity disorder, or ADHD. ADHD has commonly been associated as a neurological disorder primarily present in adolescents. However, this is not the case, and it has recently seen greater research across all ages. The range through which ADHD can affect an individual is varied, showing symptoms via hyperactivity, impulsivity, and/or inattention. These symptoms are thought to be evident due to defective or malfunctioning neurotransmitters in the brain that fail to activate or, in cases, overactivate during incorrect situations. In a meta-analytic study conducted into functional MRI studies on ADHD, fMRIs used to create voxels have identified areas of over- and underactivation when compared to a control group of those without ADHD. As per the image, it can be seen that there is a definite underactivation of the frontoparietal network, which coordinates internal attention processes. The overactivation of three separate areas can be additionally observed: the visual, dorsal attention, and default mode networks. These areas, when a task is present that requires attention or complex cognitive function, should remain relatively inactive, showing clear signs of the symptoms inattention and hyperactivity. Transcranial direct current stimulation is a form of neurostimulation that works to modulate cortical excitability. Through this process, sections of the brain are stimulated with a conductive rubber electrode with variable currents that are designed to excite neurotransmitters. It was initially designed to repair or stimulate defective sections of the brain in those who suffered from psychiatric or neurological disorders, such as a stroke. tDCS has been thought to potentially have an impact on those affected by ADHD through the findings into proven ability to assist in improving short-term memory. Through the activation of neurotransmitters, it can improve the cognitive ability of those whose neurotransmitters do not work. This is of specific importance to patients affected by ADHD. Studies into the field of tDCS have been ongoing for approximately 2 decades. However, research into the effects of ADHD are much more recent. A study conducted by Cosmo was conducted through a double-blind sham test involving a go-no-go test amongst a group of randomly assigned people with and without ADHD. The results from the study found no conclusive results showing a linkage between tDCS and improved cognitive function. Similar to the study by Cosmo, a double-blind trial was conducted by Cachoeira's team to test the time in completing a simple test. Post-application of the tDCS, it was found that there was a much greater improvement in the group with ADHD. This provided a positive result for Cachoeira's hypothesis that tDCS should show a reduction of ADHD symptoms. An additional study was conducted by Allenby and team, who were seeking to assess how tDCS applied to the dorsolateral prefrontal cortex could improve impulse control in participants with ADHD. This was conducted again through a double-blind method using the NBAC training test. The results of this study provided supportive results in the use of tDCS, with the results indicating an improvement in impulse control following application of tDCS. The study into the effects of tDCS on people with ADHD have shown results that remain inconclusive. The studies conducted have been into specific regions within the brain, rather than the overall effects in general. This has allowed for insights into the effect of the brain through each region. However, it has not allowed for an understanding of the holistic effects of tDCS on the brain, or how all symptoms collectively are affected. This leaves room for each set of the sections yet to be studied to be researched, as well as an opportunity for a possible meta-analytic study. The studies also fail to detail what are the long-lasting effects of tDCS on someone with ADHD. The effectiveness of the treatment needs to consider repeated use, length of time conducted, and how long the effects last, which are all factors into the actual potential of the treatment. And here are just a few of my references.